Welcome to the deep dive. Today, we're really going deep on hyperbaric oxygen therapy, or HBO2.
That's right.
You might have this picture of just breathing pure oxygen in, a pressurized room.
hmm
But believe me, the science behind it is, well, it's fascinating. And that's what we want to get into today. We're here to really unpack the core science, some surprising applications, too.
Exactly. Forget that simple image. We're diving into the fundamental mechanisms, how it actually works,
Yeah,
and yeah, some pretty remarkable effects HBO2 has, all based on solid science.
right.
Our goal here is to give you those aha moments, that clear insight without, drowning you in jargon.
And just to set the scene a bit,
Yeah.
think about where these chambers first popped up.
Yeah, it wasn't hospitals initially.
No, like tunnel construction, underwater work,
Yeah.
really tough environments. Back then, it was mostly about decompression sickness, right? Avoiding the bends.
Tools born out of necessity in these pretty extreme situations.
So it's interesting then that it took until, the 1960s for it to really start moving into mainstream medicine.
Yeah, that seems to be the key period. That's when researchers really started digging into how it worked therapeutically, beyond just dealing with the pressure issues from diving or tunneling.
Okay, so let's unpack this. Someone goes into the chamber for HBO2. What are the main physical things happening?
Fundamentally, you've got two primary physical effects happening. First, there's the increased partial pressure of oxygen, more oxygen getting pushed into the system.
Okay.
Second, you have the hydrostatic pressure itself, just the increased physical pressure.
Right.
And that hydrostatic pressure, that physical squeeze, is really important for any condition involving gas bubbles. Think embolisms or decompression sickness, the bends.
So it literally helps shrink the bubbles.
Exactly. Like squeezing a sponge to get the air out, it mechanically reduces the size of those bubbles.
Okay, so pressure handled the bubbles. But you mentioned earlier that most of the other benefits, the wider therapeutic stuff, comes from something else.
Precisely. While that pressure is critical for those gas issues, the really broad therapeutic impact of HPO2
Yeah.
mostly comes from that significantly increased partial pressure of oxygen reaching all the tissues.
Okay.
And that big boost in oxygen, well, that sets off a whole cascade of biological responses.
And one of the key things here involves reactive oxygen and nitrogen species, ROS and RNS. Now, those sound kind of bad, like oxidative stress.
Well, yes and no.
Hmm.
In large amounts, absolutely, they can cause oxidative stress and damage cells. That's the downside we often hear about.
Right.
But the controlled, intermittent increase you get with HBO2 is different. It actually turns these ROS and RNS into vital signaling molecules inside the cells.
Signaling molecules, how does that work?
Think of it like this. The brief pulse of increased ROS RNS acts like a small, controlled stress signal. It doesn't overwhelm the cell, but it sort of wakes up its defense and repair systems. It triggers these intracellular transduction cascades, basically chains of communication within the cell, which ultimately leads to the production of things like growth factors, promoting healing and adaptation. Tom's research really dug into the biochemistry here, showing how O2 at these higher pressures influences these reactive species beneficially.
So, a little bit of stress, paradoxically, triggers a healing response. That's fascinating. How did this translate into the early therapeutic effects people noticed?
They saw several key things pretty early on. First, obviously, just getting way more oxygen dissolved directly into the blood plasma.
Right, bypassing the red blood cells limitation to some
Yeah,
extent.
exactly. Delivering it straight to tissues starved of oxygen, ischemic tissues. Second, they noticed that it had antimicrobial effects on certain bacteria, especially anaerobes, the ones that hate oxygen,
Makes sense.
but even some aerobic ones too. It also helped clear carbon monoxide poisoning much faster,
Oh, interesting.
and it caused vasoconstriction narrowing of blood vessels, but crucially, without actually worsening oxygen deprivation downstream. This made it useful for things like acute peripheral ischemia, like a suddenly blocked artery in a limb. And finally, it seemed to kickstart healing in wounds that were just stuck. Chronic wounds that weren't getting enough oxygen to repair themselves.
Wow, okay, so it was hitting quite a few different problems right from the start. Who were some of the pioneers making these connections?
Well, you had Albert Benke, way back in 1937, suggesting oxygen during recompression for the bends. He saw the synergy between pressure and O2.
Okay.
Then, around 1955, Churchill-Davidson had this really novel idea, using high-pressure oxygen to make cancer cells more sensitive to radiation therapy.
That's clever, using oxygen to boost another treatment.
Yeah, enhancing radiosensitivity. And then you absolutely have to mention Professor Ike Borama in Amsterdam. His work around 1956 was Pretty groundbreaking.
What did he do?
He did these animal experiments in hyperbaric chambers, showing that during cardiac rest under HBO2, you could significantly extend the time before irreversible brain damage set in. It led him to propose this almost sci-fi concept of life without blood being potentially possible under HBO2, just highlighting how much oxygen the tissues could store when dissolved under pressure.
Life without blood, that really paints a picture. Did his group look at infections too?
Yes, they did. Researchers there also found HBO2 was effective against gas gangrene, these nasty clostridial infections caused by anaerobic bacteria. That really spurred more research into its antimicrobial side.
Okay.
And we should also mention Smith and Sharp, who specifically showed how HBO2 sped up recovery from carbon monoxide poisoning.
So a lot of key observations laying the foundation. Now, what about this idea of repeated treatments? Does the effect build up? You mentioned a pharmacological effect?
Exactly. That term comes from Kinwall. He proposed that repeated HBO2 sessions weren't just about the immediate oxygen boost each time, but that over time, these repeated exposures led to a gradual accumulation of things like anti-inflammatory mediators. It hinted at deeper, more complex changes in cell signaling, antioxidant pathways. More than just flooding tissues with O2 temporarily. It suggested oxygen itself could act like a drug with cumulative effects.
Okay, that makes sense. So moving to more established uses now, those really difficult non-healing wounds like diabetic ulcers or radiation injuries, how does HBO2 help there?
Yeah, that's a major area. It's about improving neovascularization, basically, growing new blood vessels into the damaged area.
Okay.
In these chronic wounds, you often have a perfect storm. Not enough healthy cells, poor structure, chronic inflammation, and crucially, a lack of oxygen and the signaling molecules needed for repair.
Like trying to build on really poor ground with no supplies.
Exactly. HBO2 helps on a few fronts. It promotes angiogenesis, new sprouts from existing vessels, and also vasculogenesis.
Vasculogenesis, what's that?
That's recruiting stem and progenitor cells, often from the bone marrow, which then travel to the wound and help build new vessels from scratch.
Oh.
The increased oxygen helps fix problems with making the extracellular matrix, the scaffolding for new tissue, and it stimulates the release of critical growth factors.
And you mentioned stem cells from bone marrow.
Yes, that's a key part of the vasculogenesis story. HBO2 seems to trigger the release or mobilization of these progenitor cells from the bone marrow into the bloodstream. They can then hone in on the injury site and accelerate healing. And importantly, it does this without just broadly increasing all blood cell counts, which you wouldn't want.
Right.
And interestingly, that mild oxidative stress from HBO2 we talked about, it actually encourages these mobilized stem cells to produce more growth factors.
So the stress signal works on them too?
Seems like it.
Yeah.
It might be linked to stabilizing a key protein called HIF, hypoxia-inducible factor, which normally responds to low oxygen. It's like HBO2 mimics some aspects of that signal pathway.
Yeah.
Tutton compiled a pretty detailed list of these potential triggers in non-healing wounds.
It really sounds like a complex, coordinated response. What about when tissue damage happens suddenly from ischemia, loss of blood flow? Like a crush injury or maybe after surgery, like reattaching a limb?
Yeah, that's another important area, improving post-ischemic tissue survival. There's good clinical evidence for HBO2, helping in things like extremity reimplantations, skin grafts or flaps, and severe crush injuries.
Okay.
We're also seeing promising data suggesting it might reduce restenosis re-narrowing after coronary angioplasty and maybe improve heart muscle recovery after a heart attack.
Really? So potentially cardiovascular benefits too?
Potentially. And there's research exploring it for liver transplants, maybe reducing brain issues after bypass surgery. It's quite broad.
And is the treatment approach different for these acute situations versus the chronic wounds?
Yes, typically. For these reperfusion injuries where blood flow is restored after being blocked, the protocols often involve shorter, maybe more frequent sessions, but at higher pressures, like 2.5 to 3 atmospheres absolute, often just over a few days, not the longer courses for wound healing.
Higher pressure, shorter duration. What's the key mechanism there when blood flow comes back but can cause its own problems?
A really critical mechanism involves neutrophils. These are white blood cells, first responders to injury. When blood flow is restored after ischemia, these neutrophils can get sticky. They adhere to the walls of the small blood vessels, mediated by proteins called beta-2 integrins. Think of them like Velcro.
Okay.
And this sticking can actually block the capillaries and impede the return of blood flow,
Yeah.
causing more damage. That's reperfusion injury.
Right, the solution causing another problem.
Exactly. HBO2 seems to inhibit this neutrophil adhesion. It reduces their stickiness. It seems the increased reactive species generated during HbO2 modify a protein inside the neutrophil, affecting those integrants. So the neutrophils don't stick as much, allowing better blood flow restoration in the tissues.
And this doesn't stop them from fighting infection when needed.
Apparently not. It seems to specifically target this adhesion mechanism without broadly suppressing their immune function. Plus, HbO2 has other anti-inflammatory effects, like reducing pro-inflammatory cytokines and boosting some protective proteins. Animal studies even suggest pre-treating with HbO2 can make organs more tolerant to subsequent periods of oxygen deprivation.
Fascinating. So it's modulating that whole inflammatory cascade that follows ischemia. Now, you mentioned antimicrobial effects earlier, too. How does that work exactly?
Well, for obligate anaerobes bacteria that just can't live with oxygen, the high oxygen levels are directly toxic,
Kills them outright.
pretty much. They lack the protective enzymes, like superoxide dismutase, to handle the oxygen radicals generated. Some research also suggests that total pressure itself might play a role, not just the oxygen concentration.
Interesting.
And beyond direct killing, HbO2 can also enhance the function of our own immune cells, particularly neutrophils or neutrophil-like cells. It seems to boost their phagocytic activity, their ability to engulf and destroy bacteria.
So it helps our own defenses work better, too.
Right, it's kind of a dual effect in wounds. Better bacterial killing, which is good, but that could be pro-inflammatory. However, HbO2 also seems to promote the programmed death, or apoptosis, of these activated neutrophils later on, which helps resolve inflammation. So it might strike a useful balance.
A complex interplay. Okay, one last, air bone healing. You mentioned potential there, too.
Absolutely. The mechanisms are still being fully mapped out, but HbO2 is showing real promise for conditions like chronic osteonecrosis bone death due to lack of blood supply. Think of the hip joint, for example.
Right.
Studies suggest that intermittent HbO2 stimulates osteoblasts, bone-building cells,
Okay.
and importantly, it seems to suppress osteoclasts, the cells that break down bone.
So it tips the balance towards building bone.
Exactly. And interestingly, some research indicates HbO2's effect against osteoclasts is stronger than just high oxygen or high pressure alone, even working in low oxygen conditions. They've seen reductions in specific markers related to osteoclast formation and activity.
And it helps the bone builders, too.
Yes, it appears to enhance their differentiation, becoming mature bone cells, and their mineralization activity, actually laying down new bone material. There was even a retrospective study showing reversal of femoral head necrosis in some patients treated with HbO2.
That's really quite remarkable for such a difficult condition. So across all these areas, wounds, ischemia, infection, bone, the applications seem diverse and the science is getting clearer. But are there still big unknowns?
Oh, definitely. A major one is figuring out the optimal dosage for different conditions. What's the ideal pressure, duration, frequency, and what's the minimally toxic dose? We need to maximize the benefits while minimizing potential side effects from, say, too much oxidative stress over time. That optimization is still ongoing work.
Finding that therapeutic window.
Precisely.
So if we were to sort of wrap up this deep dive into the science, what's the main takeaway from all these sources?
I think the big picture is that while HbO2 isn't new, our understanding of how it works at a deep biological level has really exploded in recent decades. It's not just about pumping oxygen in. It's actively modulating inflammation, driving new blood vessel growth, helping fight infection, influencing stem cells, impacting bone remodeling. Really complex stuff.
Yeah.
And while maybe awareness among all healthcare providers isn't universal yet, the scientific foundation for its use in specific approved conditions is getting much stronger.
It really has been a fascinating journey, hasn't it? From those early, almost rudimentary uses for the bends to this sophisticated understanding of cellular signaling and tissue repair.
Yeah.
It makes it clear HbO2 is so much more than just breathing oxygen under pressure. It's triggering these really profound physiological responses. Considering this multifaceted impact of just oxygen under pressure, it makes you wonder, doesn't it? What other seemingly simple physiological factors, things we might take for granted, could hold untapped therapeutic potential that we're only just starting to understand?
That's a great question. It highlights how intricately our bodies respond to the environment, even subtle changes.
Exactly. And as the research continues, refining protocols, understanding dosage, it seems likely that HbO2's role in medicine could become even more significant down the road.